sleep well last night, anything like that.
I work for Mount Holly Rehab. I've been here 13 years, and I'm a manager in housekeeping. I was a housekeeper when it was called Carolina Healthcare over at the main hospital. We clean the rooms, we dust mop, we varnish the floors. We have days where we do detailing, we do the trash. We're responsible for the shredding bins. We're responsible for linen. We're responsible for ourselves. We're responsible for the patients, making sure we provide excellent service and are keeping their rooms clean.
I am the Senior Administrative Assistant here to Peter Cassidy. He's the Vice President of Carolina's Rehab. I have worked here, this is my second year. I have a bachelor's degree in psychology, and I'm working towards getting my master's degree in health administration. To be an administrative assistant, you do not need to have a bachelor's degree. It is recommended that you have an associate's degree, and a bachelor's degree is great, but a high school diploma is required for my position. You do need healthcare experience to be a senior administrative assistant.
I'm the Rehab Tech at Carolina Rehab, Mount Holly here. My duties as an X-ray tech include processing X-rays that the doctors order. I follow them up with all the doctors that work here. I take care of the inpatients, and I take care of outpatients from the clinic up front. To become an X-ray tech, I had to go to a 2-year school program. I did that up at New York after I retired from the New York City Police Department. There's like 4 different fields of radiology. They include general X-ray, ultrasound, CAT scan, and MRI. Each one you need a separate program to do. So I stay under just doing general X-ray.
So as an occupational therapist, I'm part of the therapy team here. We work on getting patients back to being home safely. We work on things to make them more independent, make them stronger after being in the hospital. Some diagnoses that we see are patients that have had strokes, they've fallen, they've had infections or heart attacks. So we really focus with the patient to reach their goals and to get them home as soon as we can. So for occupational therapy, you have to have a master's degree to have the master's degree or doctorate degree for this profession. You have to take a bunch of prerequisite classes in college. So for me, I was an exercise science major, and I took a lot of anatomy, a lot of physics and chemistry classes, and then I went to a graduate school and learned very specific things for this profession.
So my job as a rehab assistant or rehab tech, there are a lot of names for it, basically to help assist Alyssa, one of the OTs or physical therapists, with help with +2s if they need help with chair follow, help set the equipment up for therapy. They let them know ahead of time, hey, I need a +2 with this, I need this equipment. So we go around and just get everything started to help make their day easy. That's the best way to describe it. We do keep things clean after each treatment, keep everything organized, set up the wheelchairs, putties, you name it, that's what we do. So we just kind of help make the therapist's day easier for them. For our schooling, yes, I went to Penn Foster, which is an online course, and that basically opens up and talks about what each role of a physical therapist, occupational therapist, and speech therapist does. And I did get training outpatient. So you do a lot of hands-on training, learning with transfers, learning the muscles, lower extremity exercise, and upper extremity exercise.
And here at Mount Holly, we work as a team with a lot of different therapists. So with the techs, and the occupational therapists, there's also physical therapists and speech therapists, which Kalina mentioned. Physical therapists, they work on a lot of mobility with the patients, and their education is they go to high school and then college, and then it's a doctorate degree after that, which is an additional 3 years after college. Speech therapists, they work on if a patient has speech deficits or swallowing, or to help with their brain, because a lot of times with the patients we have there, their brain's affected, so they work on a lot of cognition. And they go to high school, college, and then 2 extra years. So we're gonna do a little demonstration of the patients that I see and kind of the intervention strategies that I like to use. So Coco here is gonna represent someone that had hip surgery, And one of the things that you can't do after hip surgery is bend your hip past 90. The hip needs to heal, and you don't want to, hurt anything. A lot of surgeons are really specific on that. But, Coco wants to take off her shoes and show you her awesome socks that she has underneath. So we're gonna kind of go through some ways that she can use that to remove her shoes and put on a pair of nice socks without breaking that precaution. So this here is a dressing stick, and it has these pieces that you can manipulate clothing with. So Coco, I'm gonna have you take off your shoe with that. She's been practicing really hard.
SpongeBob.
Beautiful. Show off those socks. Awesome. Okay, so you can use this to also take off a pair of socks, take off shoes, and all of that. So now she needs to put on her socks that have the grip, because we're very, very specific about the socks that we like our patients to wear. So what you're gonna do is you're gonna put this over this awesome sock aid. Okay, you're gonna slip it right in like a shoe. This has to be on the back because that's the point of the sock, is to have the grips on the bottom, and then you just pull it up. Wonderful. Look at that.